The BLS assessment is a simple way to quickly identify if resuscitation is required. It is the same for all ages and is performed quickly. Before anything else, pause and assess the scene for hazards. Take standard precautions to prevent contact with blood or other potentially infectious materials. If it is safe, check for responsiveness. Tap or squeeze the person's shoulder and ask loudly, "Are you all right?" For an infant, tap the foot. If unresponsive, quickly look for signs of normal breathing. At the same time, check the carotid pulse in the neck. Normal breathing is effortless, quiet, and regular. Weak, irregular gasping, snorting, or gurgling sounds, known as agonal breaths, can occur early in cardiac arrest. These actions provide no usable oxygen. This is not normal breathing. For an adult, check the carotid pulse in the neck. Locate the bony Adam's apple with your fingers, slide them into the groove between the windpipe and the muscle on the side of the neck closest to you. For a child, check the carotid pulse or the femoral pulse in the leg. Place your fingers just below the middle of the crease where the leg and torso meet. For infants, feel the brachial pulse on the inside of the upper arm. Lay your fingers across the arm and compress inward. Take at least 5 but no longer than 10 seconds to assess breathing and pulse. If you are unsure, assume they are absent. If not already being done, tell another person to activate the protocol and get an AED. Relay what you have found so it can be passed on. Your assessment of the person and situation will determine the care you provide. If the person is breathing normally and uninjured, place her in a side-lying recovery position. Place the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the person toward you in a single motion, keeping the head, shoulders, and body from twisting. Make sure the head ends up resting on the extended arm. Roll far enough for the face to be angled towards the ground. Make sure there is no pressure on the chest that might restrict breathing. The recovery position helps protect the airway by using gravity to drain fluids from the mouth and keep the tongue from blocking the airway. Frequently assess and monitor the person's breathing. The condition can quickly become worse and require additional care. If the person is not breathing or only gasping, but definitely has a pulse, he is in respiratory arrest. The indicated care is rescue breathing, which is ongoing rescue breaths provided without chest compressions. If the person is not breathing or only gasping and does not have a pulse, he is in cardiac arrest. The indicated care is CPR, a repeating combination of chest compressions and rescue breaths. Always perform a BLS assessment to quickly determine the need for CPR. Ensure the scene is safe. Assess responsiveness. Assess for breathing and pulse. Activate the emergency response protocol for your setting and get an AED.